Hello friends, and welcome to another video by Nursing Simplified, the smart way to survive nursing school. In today's episode, we're going to talk about the top 10 myths about the NCLEX, and we're going to debunk them. And make sure you stick around for my favorite at number 10. It's a doozy. Myth number 1. The NCLEX is a standardized exam. So first, what is a standardized exam? Well, in a standardized exam, each student is given the same questions and their answers are scored in the same way. Oftentimes, students are then graded on a percentile that compares them to other similar students. The NCLEX, on the other hand, is a CAT exam, and CAT stands for Computer Adaptive Test. In a computer adaptive test, the computer asks the students questions increasing or decreasing in difficulty based on how they have answered previous questions. Once the computer determines the test taker's competency level, whether that is competent or not yet competent, the computer ends the exam. The exam has one mission and one mission only: to determine if it is safe for you to begin practicing as an entry-level nurse. On to myth number 2. The length of the NCLEX exam matters. So now that you understand what a CAT exam is and how it works, so you might be thinking that the sooner the exam stops, the better you did. But this is just not true. The length of your NCLEX exam is solely based on how you answer the questions. If you answer questions correctly, you will get harder questions. If you answer incorrectly, you will get easier questions, but it doesn't have anything to do with the number of questions. Therefore, you can pass or fail regardless of how many questions are asked before the computer stops the exam. So the length of the exam is not an accurate indicator of how the computer determined your competence level. Okay, moving on to the next one. Every NCLEX question counts. Well, that totally makes sense, right? But this is only partially true. Every year, the NCLEX tries out up to 15 experimental questions that are not counted toward your score. Well, that sounds like great news, right? That's 15 questions that you can get wrong. Not really. The caveat is that you have no idea which of the questions are the experimental questions. So you have to treat every question as if it counts. Myth number 4. The NCLEX is easier in different states. Guess what, guys? The NCLEX is a national exam. It's the same in every state. In fact, fun fact, they use the same exam in Canada as well. The only differences between states are some of the rules regarding licensure and exam taking. For example, how many times you can take the exam, how long of a waiting period must there be between attempts, and whether or not you have to prove you took a refresher class before your next attempt. But with all that being said, the exam itself is exactly the same. On to myth number 5. The more select all that apply questions you get, the better you're doing. Well, I think that most of us would agree that select all that apply questions can be particularly challenging. So I can understand where this one came from. However, the number of select all that apply questions that show up on your test is not an indicator of how you're doing. One test taker may get 10 select all that apply questions, and another might get 30. It's all part of that CAT methodology to ensure that each test taker has a different experience. So remember, you don't get partial credit for select all that apply questions. So take your time and just concentrate on doing your best, no matter the type of question. Myth number 6. You can't stop until you're done. This is not true. In fact, there are 2 scheduled breaks for test takers. In addition, Test takers can take additional breaks if needed. In fact, research has shown that performance declines over the course of a test taking session. The longer test takers focus on a task, the more their cognitive resources were depleted. So, the longer you sit in front of the exam, the higher the risk that you will not do as well. The good news is that performance recovers following breaks between sessions. So please, take breaks if you need them. Simply raise your hand, stretch, get a breath of fresh air, and clear your head for a few minutes. You might be surprised at your level of confidence when you sit back down to resume the exam. But just remember, your exam timer keeps ticking, so don't overdo it. Myth number 7. The last question determines your destiny. Some people believe that if your exam ends on an even or odd number, that it means something. I am not sure where this one came from, but it sounds like pure superstition. Remember, you can pass or fail regardless of the number on which your exam ends. There are no hidden secrets or tricks, so just focus on the task at hand. Number 8, the new NCLEX is here. You may have heard that the next generation NCLEX has been developed, and there is truth based in this. The plan is to rework the NCLEX exam to test students on their critical thinking skills over memorization of facts. The rumor circulating is that this new format is here, but it simply isn't. At the time of this recording, the next generation NCLEX won't be available until at least 2023. I suspect the challenges over the past few years had something to do with the delay, but it is on its way. Myth number 9. You have to remember everything to pass. This is not true. In fact, it's not even possible. And this is why students who attempt to cram for the NCLEX don't typically pass. The NCLEX is organized to determine if you are competent to meet client needs as an entry-level nurse. It's more about how you use your critical thinking skills to make decisions based on what you already know. So remember, the NCLEX is not designed to trick you. It's designed to determine competence. If you remember that as you prepare to take the exam, you will do much better. Okay, as promised, this is by far my favorite. Our last myth is known as the Pearson view trick. And hit that like button if you've heard of this one. I have to give credit where credit is due. Whoever thought of this one is brilliant. I hope they put as much effort into preparing for the exam as they did trying to find out if they passed. The Pearson view trick is used by students who become impatient waiting for results. The theory is that you try to re-register for the NCLEX exam. If the system allows you to register, then you must have failed your initial exam. If it doesn't let you register, then you must have passed. There are even websites that are dedicated to explain all about this trick. However, even on these websites, it says the trick may work. And the worst case scenario is that you get charged for another exam that you didn't need to take in the first place. Listen, I know it can feel like forever when you're waiting to find out your results, but this trick is simply that, a trick, and it doesn't work. The good news is that there is an official quick result service where you can find out if you passed within 48 hours. This is the only method approved by the National Council of the State Boards of Nursing. The NCLEX results in the quick results service do not authorize you to practice as a licensed registered nurse. Only the State Board of Nursing can release your official results with your license, which will be sent to you approximately 6 weeks after taking the exam. But you can find out if you passed or failed. Okay, so let's recap. The NCLEX is not a standardized test. The length of the test does not matter. Every question does not necessarily count, but you should treat them as if they do. The NCLEX is the same in every state. The type of questions are not an indication of how well or how poorly you're doing. The number your test ends on does not predict pass or fail. Next generation NCLEX format will not begin until at least 2023. You don't need to memorize everything. Take breaks if you need them. And the Pearson view trick does not work. So that's it, guys. Today we talked about the myths surrounding the NCLEX. In our next video, we'll be reviewing the top 10 methods you can use to pass the NCLEX on your first try. Don't forget, you're beautiful, you are needed, you are loved, you are strong, and most of all, dear friends, you are enough. Now go out there and be the amazing nurse you were meant to be. And remember, nursing is a work of heart. See you in the next video. Bye-bye.